Good afternoon, and welcome to today's webinar titled Improving the Patient Experience in a Highly Regulated Industry, Save Time and Stay Secure. My name is Jeanette Wider, and I'm Managing Editor of Healthcare Innovation. Today's program is sponsored by Soprano Design. Thank you to our sponsor and to our audience for giving us your time and attention today. Before we get started, we have a few housekeeping details. To submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, join our webinar conversation on Twitter. You can tweet using the hashtag HILiveWebinar. At this time, I'd like to introduce Jane White, Marketing Manager, Soprano Design. Jane, I'll let you take it from here.
Thank you so much, Jeanette. That's a really wonderful intro for our webinar that we're presenting. This webinar for the healthcare industry is one that really energizes me because we have been serving critical messaging industries for a very long time at Soprano, and healthcare is one of our favorites. And I am a specialist in our fraud and security products as a product marketing manager at Soprano. And so those products are really, really important to the healthcare industry and all of our deployments. And some of our most interesting deployments with SMS is in healthcare. Actually, at the time that it was launched, we had one of the largest deployments of SMS anywhere in the world with a healthcare institution in the UK. And as we know, the UK sort of uses a single, very large government body to orchestrate their healthcare. And so anytime anybody got an appointment reminder for any healthcare related thing in pretty much the entire United Kingdom, that message will be and was and has always been sent by Soprano. So that's just one of those examples where it's a scalable deployment, but just something really exciting that we're all proud of here at Soprano. And we love all of our healthcare use cases. It's just a really interesting industry, and the use cases for SMS and mobile messaging in healthcare is expanding all the time. Before I go into that and talk about how we can expand on our current use cases and understanding of SMS in healthcare with new and creative ways of messaging and elevating patient experience, I want to put this QR code up here. It will allow you access to a bundle of resources, and the headliner of those resources is our latest fraud and security white paper, which we just published. And this white paper is a really, really good starting off point if you're trying to close vulnerabilities in a communication chain that is getting ever larger, and understanding all the points of vulnerability in that communication chain as they relate to any industry, but definitely healthcare, because as we know, mobile and other cybercrime schemes are getting much more complicated, much more organized, and much more effective against larger institutions that have traditionally very secure systems. So definitely check that out. We'll flash this QR code up again at the end of this presentation, and we'll talk about all of those vulnerability points here, but that white paper is a really good resource, so definitely check it out. So to lay the groundwork for what we're going to be talking about today, I've put these sort of three bubbles together, and obviously with any Venn diagram, you have a little tiny bit in the center there, and that's the sweet spot. And we're trying to answer the question today, why is good patient communication so difficult? And find out how we can make it easy, how we can make it much better. Because we have been living in a world where appointment reminders, we've seen how effective and impactful that can be for getting people on time and reducing no-shows and having people in the door for their appointments or in their virtual appointments on time. But there's so much more that we can do for patients and doctors and every kind of administrator, office staff, nurse in any healthcare institution with the right kind of communication. But we have to have it living within that sweet spot in the center where it's relevant and compliant. And of course, we know in the healthcare world, that bar is very, very high. Similarly, software tools that are really secure are really critical to any deployment, because if you have one vulnerability in your system, all of your patient data could potentially be at risk. So there's another really high bar to hurdle over there. And then the resources to execute encompasses multiple things, but I think chief among them is time. Time is a resource, especially the time of doctors or other folks in healthcare institutions that are actually seeing patients. Their time is a scarce resource, getting scarcer, as we know, and we don't want new use cases and elevated patient experience communication methods to be a detractor from their time and to add to their list of tasks every day. So we'll talk about how we can avoid that while making some really good movement towards better patient experience and communication. So we'll start with talking about secure software tools. And one of the important things to lay out before we talk about the software tools and the vulnerabilities that can potentially be exposed there with communicating patients is the ways that we're currently communicating with patients. And we've been relying on these two on the left for a very long time. Emails, which typically route patients to portals, and phone calls. And for those patients who are part of an older generation, phone calls are super, super effective. Almost everybody has an email address, and many people have a device, a laptop, a way to access the internet. And that's just a really reliable kind of tried and true way to get folks back into their patient portals to communicate with them. However, both of these channels we know are becoming less and less effective over time and are becoming a not preferred channel for a lot of people underneath their new choice, which would be mobile messaging or SMS. So email open rates are dropping every day, and most people nowadays, if they do not recognize the phone number calling them, will not pick up the phone at all. So using SMS or a multi-channel approach when communicating with patients can be really powerful and sometimes necessary. So again, we want to ground everything that we talk about today in security, because security is an issue that will persist as a priority in healthcare no matter what. But in this moment, it's an even bigger priority than it really ever has been because of what I mentioned earlier, which is breaches and cyber criminals are much more organized. Oftentimes they are working as a team of engineers, and whether they're remote or local, no matter how they are attacking your systems, they're more likely to attack systems than they ever have been before. And they're doing one-to-many attacks rather than one-to-one attacks. So the days of, avoiding the typical phishing email or smishing message and being in a safe haven and, relying on that education is over, basically. We're seeing many, many, many new types of sophisticated data breaches that are basically unavoidable if you only are preventing against phishing and smishing. You're looking at access hacking, you're looking at artificial traffic inflation, you're looking at roaming intercept fraud, and all different kinds of different and new ways to steal login credentials. And all of this can be hugely detrimental to reputations. And of course, our patient data is the gold mine that we absolutely must protect. So we definitely don't want to end up in these headlines when we bring in new communication use cases to our environments and new tools. So typically, as I mentioned, smishing and phishing are really, really common sort of the choice method of yesterday and still prevalent today. Many, many people, I think around the holidays, get an increased number of smishing and phishing messages, not related to healthcare, but in general, we all become increasingly aware of how many people there are out there trying to access our data and potentially can spoof an EHR system or a login portal, get login credentials, use it for other things, just trying to steal your personal data. It's so, so common. But also insecure software systems are the other way that we see more dangerous attacks playing out and being executed. So there's a couple of different ways to prevent against that, but with our recommendation is always to have these two things in place. And we make this recommendation partially because we assume that most people will have some form of multi-factor authentication in place, whether it's on their entire systems or just parts of their system. We want to see it across all systems. And one of the best ways to do that without creating a lot of friction or need for new training or a lot of potentially tech support related issues is single sign-on. So single sign-on is not just a product Soprano offers, but it's part of many of the software tools you probably already have. So if you don't have this implemented, it might be time to do that. And one of the ones that we see that is not as common, but is even more effective against preventing access hacking and data breaches is IP access controls. So we know that 90% or more of breaches to customer data and patient data happen because of compromised login credentials. And if your login credentials are compromised and somebody tries to log into your internal systems from an IP address that is not approved, as in they're not in the hospital, they're not on their normal network, then that attempt to log in can be rejected, even if they have somehow either spoofed your phone number or routed your code to their device or swapped your SIM card, whatever. If they're not on the correct IP address, then your data and your patient portal is protected and all your internal systems are going to be in that safe haven of their own IP access network. So something that we recommend as an additional layer of security, because again, login credentials are usually the source of your problems when they're compromised. So the next circle that we want to think about here when we're implementing new use cases, and we have a lot of new interesting use cases that we're going to surface at the end of this presentation just as examples, because they're so powerful and we really wanted to be not just thinking about security, but again, everything we do is for making a better patient experience. But this bucket right here is where we're talking about the experience of doctors. So doctors and administrators in most healthcare institutions have said to folks at Soprano in our teams, especially our consulting and executing teams, we're really tired of getting calls to our front office and to our administrative staff about, oh, I can't log into my portal, or, oh, I can't get this communication that they need. And it's just so common. We want to eliminate that when we're using new forms of communication. And so many times the communication that we send out is just routing people back to the portal. And that's necessary because the portal is a safe place to share customer or patient data. And it's also a place where we're allowed to share certain types of patient data, whereas emails, phone calls, and especially SMS, there's a lot more restrictions there, even if we're able to elegantly opt in a lot of our patients to those types of communication. So if a patient is seen by a doctor, the patient needs a follow-up. Oftentimes, the doctor will update the EHR and either manually send out a message or it's automated in some way. And if the patient gets an email or a phone call, oftentimes it either is ignored or they don't know that they've received a message from their doctor or their healthcare institution, and it's going unnoticed. And if they do get it, many times they are immediately directed to their portal. They're unable to log in. Who's the first person they call? Usually the administrators in the front office of the doctor that they're expecting a communication from. And this is a big problem because those folks shouldn't be spending their day basically providing IT support and tech help. They should be helping the patients that are right there in front of them. So the patient then will be routed to some kind of help support, or that person will help them and then they'll be able to log in. But again, that's time wasted and it's not a great experience for the patient, because if whether they get the message or they don't, there's that waiting time and that frustration. And there are a lot of ways around this. I'll give a couple of examples again in a few slides. So we know doctors are spending almost half of their time in EHRs right now, and that's not necessarily a problem, but a lot of those logistical tasks can be done in different ways. And communication is one of the number one time wasters for doctors in EHRs. So I'm going to jump ahead to this slide here. The Ponemon Institute does a lot of research in this industry, and their research shows that 45 minutes a day is wasted for doctors in hospitals on inefficient communication systems. And that's just an example of how difficult it is to make sure we're communicating, make sure we're delivering those critical messages and giving the patient what they need, while also being very conscious of doctors' time. Because while doctors are often the only ones who can see and interact with that patient's data and that patient's private information and records, that also makes them the only person that can handle certain communications. And there are ways around that. And what we're trying to do is just help the doctors recover some of that time. If you recover, for example, even 10% of a doctor's time that they spend in EHRs and allow them to take that time to then see more patients, you can recover $63,000 per doctor per year. And in a large healthcare institution, whether or not you meet that 10% delta, or if you're somewhere in there, the cost recovery can be ginormous. And of course, we're not just talking about cost when we're looking at saving doctors' time, especially on tedious logistical tasks. We're talking about burnout and quality of the job. Many, many doctors, again, who talk to our consulting teams and our implementation teams will say, we really don't want this new messaging use case or this new messaging method and channel to become a burden on our doctors because it's not worth it. And even if it helps us in our overall efficiency, we can't put that burden on them because they're tired. They don't want to do it. The number of things that we're doing in EHRs has to stay at a reasonable level, especially when it's not directly related to health outcomes and patient care. So we want to offer a couple of solutions, and these aren't, of course, foolproof fail-safes, but they do allow some of that time to be taken off of the doctor's plate and to be spread around to other administrative role titles in a healthcare institution. So having robust controls over your content masking is one of the better ways to take some of that communication time and that take the impetus off the doctor. So if you are able to mask certain parts of the patient's record and some of their personal information and pass that messaging orchestration off to an administrator, because they then are not having visibility into patient data that they shouldn't be seeing, then those administrators can then orchestrate messaging in lieu of the doctor when necessary. So content masking is a really powerful tool for protecting patient data and spreading those tasks around. And of course, we want doctors whenever possible to go back to seeing patients. Advanced hierarchy is very similar to that. It speaks to the same problem, but essentially, if you have the ability out of the box to create layers in the visibility of data and power that a person has with messaging patients in a portal that are very much structured around the regulations and policies of the industry, then you can streamline and speed up all of your messaging orchestration with the right people and make sure that that value add time is going back to doctors. So this final bubble of why patient communication can be so difficult and what we would recommend to battle against it is we want to have relevant and compliant messages going to patients. And the relevance there is one of the bigger items that I would point out, because nobody wants to be spammed by their healthcare institution. And while most people, if I move on to this next slide, you can see 80% of smartphone users do want to get messaging from their healthcare institutions. We do not want that messaging to be overinflated. We don't want it to become tedious. We need it to be very relevant and very personalized, because it not only will maintain that response rate and maintain that trust, but here in the US, brands are at stake, and relationships between patients and hospitals are very important. And when you are competing on the margins of patient experience for business in the healthcare industry, you have to consider that brand relationship. And so we know that most people the overwhelming majority actually do really want to see healthcare related messages come to their mobile phone. And we also know that Americans, 96% of them have a cell phone capable of receiving SMS. And I want to point out that this statistic is quite a bit higher than the number of Americans who have reliable access to internet and a laptop or other computer where they're accessing their patient portal or their emails. So it's not just a question of preference and convenience, but it's also a question of accessibility and equality. So something to think about when there's a lot of folks who might come to your healthcare office and they have a phone but no laptop. Giving them a mobile first message about their health could potentially get them to that critical information much faster, more efficiently. So the final stat here, of course, I want to call out is that SMS has a much higher response rate versus phone calls and emails. So Email open rates and phone calls, like I mentioned, are the number of times the person will pick up a phone call of a number they don't recognize. All of those stats are dropping like rocks, whereas mobile messaging has always been extremely consistent in that 99% of people will view an SMS message within the first 1 minute of receiving that message. So efficient communication it's really night and day when you're talking about the different channels that are available to you. And at Soprano, we do all channels, but we like to lead with an omni-channel and mobile-first approach for any industry, especially one where certain information can be time-sensitive, and the difference between getting a message that is quick and timely is sometimes really emotionally charged, really important to the recipient. And as a company that really deals mostly in critical messaging, there's no more important message than one that comes to your phone that's related to your health. So having that high response rate and quick time to communicate is really, really critical. So some of the things that we recommend to help keep those messages relevant and compliant are using a holistic journey for the use case. And some of that can be difficult because there definitely are silos in the healthcare industry, but we don't want to just think about giving somebody a message as an appointment reminder and that's the only thing we use SMS for, because there's so many more places a patient wants to be communicated with in their patient journey. So I'll give some examples again in the next couple slides, but when I go to an appointment, I have an appointment reminder. I'm also navigating. I'm also parking. I'm also finding the floor where I'm trying to go. I have my intake forms. I have my insurance. All of these things are things that I typically will communicate about right when I get to the front office and I'm talking to an administrator or a doctor about it. But that can all be done beforehand via SMS channels. And there's a lot of follow-up that we can do afterwards that will also improve the patient experience, also improve ROI, also improve efficiency. So using a holistic look at the patient journey for designing communication is really, really critical. And of course, personalization. If I get a message that I recognize the information of and I expect it, it helps elevate the trust that I have in that message. So when the message comes to me and it looks like a missing message and it says, "Hi, your appointment is this time, don't forget." It's different than getting a message that says, "Jane, your appointment at this XYZ location on this XYZ floor in this XYZ room is at this time. Click this link to start routing your way here. And don't forget to press R if you need to reschedule." All of that, I am expecting a lot of that information. They called me by name, and that personalization can be done through very, very simple API calls to current EHR data. And I'll just stress that all of our use cases are basically based in APIs, so we don't expect anybody to learn any new software systems. And all of this personalization, of course, we want it to be automated. We don't need people going in and making these messages manually. So some examples of good pre-appointment communications. A lot of these examples come from deployments that we've actually done or things that we've actually seen in our own, me and my colleagues' experience going and receiving healthcare ourselves. So this first one, navigating to an appointment, like I said, it's not just providing you a reminder to go to your appointment, but it's also suggesting that you use their link to directly route via your Maps app and helping you get a little closer to understanding where you're going and making sure that you're going to the right place, not just at the right time. And then typical appointment reminders, we want to add that personalization. And we also want to add any sort of expectation for arriving early or what the administrator will require of you when you walk in. These two examples over here on the right are really good examples of that. So I'm looking at intake forms. This message is reminding somebody who the EHR system recognizes that they haven't filled out their intake forms. They send them this message 24 to 48 hours ahead of their appointment, and that timely reminder to do the intake forms can give them that chance to get something done that relieves the time of the administrators when they show up to their appointment, and will make sure that they're on time. And then finally, logging into virtual care. This is a really, really big one because like I showed you in that patient journey earlier, many, many folks are wasting the times of administrators in healthcare offices by ringing those phones, clogging up the phone lines, and asking for basically IT support. And if you can send an SMS message to somebody's mobile phone to help them facilitate the help that they need through either an inbound flow or connecting them if they need to directly to IT support or a help desk. That's a really great way to avoid those calls coming into those front office staff folks. And we want to avoid that, like I said, whenever possible, because that direct line is not just a time saver, but it's also a better experience for the patient when they are offered that help right when they need it. And then post-appointment communications, we see appointment reminders as very widespread in the industry, and a lot of pre-appointment communications are just more common right now. But post-appointment communications can be just as critical and just as patient experience boosting. So scheduling follow-ups through a inbound SMS flow if somebody, runs right out the door of their appointment to go back to work or whatever they need to do, and they still need to schedule a follow-up, whether they need to get tested in another department or whatever, you can set that up automatically with an inbound flow and get them scheduled in the right way all through SMS. And that's something that is really powerful for efficiency again, and it is just a convenience for patients. And then delivering aftercare instructions, while you may not be able to present all of that data and all of that patient information in an SMS message, you can deliver timely reminders and make sure that people get their aftercare instructions from their portals right after when they need it, so they can start that aftercare directly when it's going to be relevant and improving their health outcomes. And results notifications are similar. We know that a lot of testing results are sort of creating an emotionally charged situation for our patients. And when we don't answer phone calls from numbers we don't know, and we aren't very diligent in opening our emails, and we do need to get a test result and it's lingering in our minds, but not necessarily in any of the communication channels we expect or are active on, the message coming through a preferred channel to let them know, hey, your results are in. And again, 99% of people will view a SMS message within the first minute of receiving it. That can be experience boosting as well. And finally, surveying. Surveying is something that we can definitely do more of in the healthcare industry because, again, here in the US, patient experience is really critical. It's a point of competition. And we also always know that when the patients have a better experience with their doctors, their health outcomes will improve and follow on. So we all need to think about better ways to serve patients, and there's no better way to know how to do that than to get a survey response right when that information is fresh in the patient's mind. So having a survey come to a patient's mobile phone 2 to 4 hours after they are out of their appointment, an amazing way to get much, much, much better response rates on our surveys for our patients. And then finally, these two are kind of some fun ones because I have seen one of these and my colleague Morgan, who's on the call, has seen another one. And it's really, these are just extra. And when you don't see this stuff very often and it comes through on your mobile phone and it's purely about patient experience, it can be so, so powerful. So this one on the left is an incentive that I received at one of the hospitals local to me in Seattle. And it said, Catherine, if you get your intake forms completed up to or more than 24 hours prior to your appointment, we will send you a QR code voucher for free parking at the location of your appointment. And because I was having a in-office appointment with my doctor and the parking at this location is very expensive, I was really, really relieved to receive this QR code right after I walked out of the door of my appointment because the EHR recognized that I had my intake forms in on time and they had set up this incentive with the parking operation at the location, and beautiful. That's a great incentive and definitely improves the efficiency of the office that I went into. And then this one on the right is a perk. We know that so many times when we go in to see a doctor, they could be running behind for a number of reasons. And when a patient is sitting in the waiting room for 35, 45 minutes, what can happen is you're just frustrating a patient. And even just a little bit of recognition of that wait time can go a long way. And this message went even longer in making sure that somebody's not feeling frustrated and instead is feeling very recognized, and even giving having something given back to them. So this message says, reply R to reschedule or reply B for a complimentary best beverage from our vendor downstairs. And of course the lead in is, hey, your doctor's running a little bit behind. So that too is something that is so unique. Not a lot of offices are doing things like this. And when you have patients coming in and seeing those little patient experience boosting details being paid attention to and offered, it can just be so powerful in improving patient experience. And again, it's a point of competition as well. So you can really differentiate with messages like these. So putting this flow up here again, I think it's pretty obvious what the difference is. And it's just that when an EHR triggers SMS and voice and email communications automatically, all with a comprehensive, cohesive message that makes sense and is personalized and is timely, the patient is definitely going to receive that communication, because whether their preferred channel is their phone or their mobile or like a voice call or email, the likelihood that they're going to receive this message with the SMS channel activated shoots up exponentially. And we don't have those calls going in anymore to administrators asking for basically tech support to get into their patient portal. A really, really critical time saver. So we have a lot of use cases around SMS globally, but in the US, we worked with a large Mid-South hospital to basically boost their, just expanding on the use case of appointment reminders. And we see so many cases where appointment reminders are the only use case at play in healthcare institutions that could definitely recover a lot of time and definitely improve their patient experience if they just do a little bit more. So sometimes we're supplementing that with voice and email. Sometimes we're supplementing voice with SMS. But in any case, expanding on that use case, either by expanding the channels or expanding the messaging, and all operating that out of the EHR automatically. So we're not creating any new tasks for administrators, and especially for doctors and nurses. That can be a really powerful booster of patient experience and something that we do. That's our day to day. So why is good patient communication easy in the scenario? So the best way to create new use cases and new patient communication journeys for your patients is have somebody else do it for you. That's why our logo is kind of there in the center, but also making sure that you're working with a partner that has really, really secure software tools that meets that really high bar for security and even goes beyond that, because there's really no industry that there's a higher bar for security and a more critical reason for having that security. And our two main industries being healthcare and finance, that bar is so high, especially over in some of our other regions where GDPR makes it, all that security is top of mind, and top of mind for me, of course, as the security and fraud expert on those products. And then compliant communication plans, the resources to execute. We are not going to ever recommend anything that's going to burden doctors in healthcare offices. And that's another thing that we always stand by. And we definitely encourage you to please download our white paper about, first, our playbook about patient journeys. It's part of this resource bundle. And then also the white paper that we've just published about the new wave of fraud and cybercrime that are really coming after mobile channels, and that cybercrime team to institution attack that is becoming ever more prevalent. And we also are offering an end of year promo. So if you're planning on sending over 100,000 SMS messages a month, we're offering 2 free security licenses. That's IP access control and single sign-on. So those 2 ones that I talked about in our secure software system conversation at the beginning of this webinar, those are 2 licenses that are super critical for locking down and eliminating vulnerabilities in your communication chain. So if you want to take advantage of that promo, please use that QR code right there. And if you're watching this recording, there'll be ways to follow up if you just use that. And that's the end of our webinar. So I'm going to open it up to questions. And I think Morgan is sort of facilitating those for me. Is that right?
I'm actually going to read the questions. So
okay.
I am back. I want to remind our audience that you can use the Q&A window at any time still. So I have the first question for you here. So you said that smishing and phishing is one of the main reasons for credentials being stolen. What's the best way to educate patient and staff on how to avoid this?
So there are many, many ways to educate patients and staff. For staff, I would always run internal tests and send fake messages. So once a internal person has received a fake message and they are basically told by their IT staff, hey, don't fall for this again. If they do fall for it, and then sending a follow-up message and say, hey, we were running a little bit of a test and this is the kind of thing you need to look out for, making sure that you are constantly stress testing everybody on these issues, because these messages are looking more and more real every single time these messages are sent. And it's very common that nowadays a smishing or phishing message will come into an internal staff person and it will look exactly like their login to their internal software systems. And they're spoofing these websites and these portals so well now that some people are giving away their login credentials really easily, and it's just a huge problem. For patients, education in all channels is really critical. So folks are getting phone calls, folks are getting text messages, and of course, as usual, folks are getting emails that are attempting to smish or phish them and basically socially engineer their credentials away from them. So making sure people understand that when they get a message that has urgency, typos, any kind of request to log into a link that doesn't look quite familiar, or they can't verify the number online of who they're sending it to, or it's not a short code. All of these things are indications that you're looking at a phishing message. So definitely using education and stress tests internally when you can.
Okay, the next question I have is, how often is it appropriate to text a patient leading up to an appointment?
That's a really good question, and it really only matters that count on how relevant the messages are. For example, if you haven't done your intake forms, if you're going to get a perk via like a QR code for free parking, and if you're going to get the location that's like, an easy click to open up my maps, I would accept all three of those messages as a patient. But if I got a message that said, don't forget about our survey, and your doctor is, put out a paper this year or speaking at a conference or something, like definitely only rely on messages that are relevant. I think 3 is like max what I just said, and that's only if they're one of them's perk related and they're all different. So please keep in mind that the number of messages that you send is always reliant on how relevant the message is. And healthcare is one of those places where it's so critical not to over message. We see this all the time in retail and the stakes are low, but in healthcare, the stakes are incredibly high because that brand trust that you have with your patients is of chief importance to everything that you do. So it's kind of a gray area answer, but I would say relying on relevance and the feedback of your patients will make sure that you're in line with what's appropriate.
Okay, and what is the ramp time to integrate and learn a new software tool like this?
New communication systems and CPaaS systems in general vary a lot on how much of a lift it is to learn and train. Some of the other CPaaS folks out there in the industry that are more geared towards B2C or kind of, have a flatter funnel than we do, typically are relying on internal developing teams and staff to A, integrate, and B, learn the messaging portal. We do all of that through our consultative delivery. So our development teams actually do the integrating, and all of it's based on APIs. So if you want to go in the actual Soprano Connect portal and orchestrate messages, you can. But most folks that we do messaging deployments for in the healthcare industry never see another portal that isn't their EHR system. So that's one of the ways that we make sure that we're not relying on that time, that critical time resource of anybody in a healthcare office, and we're not requiring any approved development time or anything like that on the side of our customers. We just specialize in these kind of deployments. We do it all the time. EHRs are our bread and butter, so we're on point to do that. The funnel there is a little longer, but the time to actually get it up and running is very, very fast.
Okay, well, unfortunately, that's all the time we have for today. I would like to thank Jane for today's excellent webinar. I would also like to thank Soprano Design for making today's program possible. Finally, I want to thank everyone in our audience for joining us. We hope you'll join us in the future for another Healthcare Innovation webinar. This concludes today's presentation.